Do you ever go to the doctor and they advise you a treatment and somehow you feel that you don't want to go ahead and you would rather have another opinion? Do you wonder if taking another opinion, a second opinion, will give you some more clarity, will give you some more guidance as to how to go ahead with your fertility journey? So, seeking a second opinion is absolutely okay, especially when you have to take some crucial decisions in your journey towards motherhood or parenthood. So, let me come out with a beautiful, inspiring, successful story of a couple that went through the treatment at our center. So now, this couple, the woman is around 31 years age and husband is around 37 years of age, and they are married for around 5 years. So they had this history of having one pregnancy which resulted into an ectopic pregnancy. And when it's an ectopic pregnancy, it is a pregnancy that is developing inside the fallopian tube. So this is something that requires most of the time requires a laparoscopic management, and one tube is removed. So she is left with one tube. So she conceives another time spontaneously, and this results into miscarriage. So this was an intrauterine pregnancy. This also actually resulted into a miscarriage. So she has a history of 2 miscarriages now. So she tries for a year thinking that she has one tube and she will conceive soon, but pregnancy does not happen. So she visits a gynecologist and she's told that okay, the pregnancy has not happened, you have tried for more than a year after the last abortion, and with the fact that one tube is not there, could be it is the tube is not working well, so IVF is a better option. So she takes an IVF treatment in another fertility center, and she actually goes through the process. She has around 7 embryos, but they are all formed on day 3 and it is frozen. So she takes a frozen embryo transfer of day 3 embryos, and around 3 embryos are transferred, and after that she is given a lot of medications, injections, inserting tablets, oral medicines. So she has a lot of them to take. So she goes through the phase, and on the day that the test is done, pregnancy test is done, it turns out to be negative. So she was really shattered and disappointed that the pregnancy does not happen. Ideally, in such a case, we expect that the pregnancy would come because of her previous history of one pregnancy, one ectopic. So we anticipate, but somehow that did not really work for her, and she was very disappointed and she did not want to take any treatment. So she kept quiet for next 3 years. In between, there was the corona phase that went through, for which she couldn't really go ahead. Plus, at the same time, she was trying naturally also, so nothing really worked. So she comes to me with this background, and upon understanding all her history in detail, she tells me that, doctor, I was really fed up taking so many medicines, so many daily injections post the transfer. Is it that I have to do all that all over again? Can I take another IVF? Because these embryos that are sitting in another clinic, they are day 3 embryos. I have 4. Should I take these or should I take another IVF treatment? She was all in confusion. So they were counseled, they were spoken for nearly around 30 to 40 minutes or maybe an hour in the first visit. And I told her that because she has the embryos already, she can take them, but she should allow it to grow for another 2 days in the laboratory and identify the best embryo. We call it as a blastocyst on day 5. So day 5 old embryo, we call it as a blastocyst. So I told them, if at all you want to pursue the transfer, then better is allow all these 4 embryos to be cultured for 2 more days and then take the transfer. So she agreed, and then I also kind of reassured her that the medicines that are going to be given post the transfer will be very limited and very few, and she said yes. So what we did was we started with a natural cycle monitoring, and she went through that process, and these embryos that were there on day 3 frozen were thawed, cultured, and she made one beautiful blastocyst, and this was transferred into her uterus with definitely very minimum medications and absolutely no daily injections. And after 14 days on test, the pregnancy test comes positive and she's really very happy. She is like, okay, is this possible with having taken only few medicines? Is it all going to continue well? Should I not take any more medicine so that the pregnancy continues well beyond and she has a good outcome? So that was the fear and anxiety that she was also having, that I'm given only so many medicines, then I was given so many injections and all those things. So she was told, she was counseled that for her situation she needs only this much, and that's how she continued her pregnancy and she delivered a beautiful baby too. So what I would like to say here is, sometimes when patients come to me and they tell that they are really scared to take the IVF treatment because they hear it from their friends that they would go through so many medications and injections. They are given a lot of them, so they are really scared and they are really not taking that they don't want to go ahead with an IVF treatment because of this fear or this scare. So I would say it is not really necessary that one has to take so many medicines post an IVF treatment. There are very few reasons where we might be giving you a lot of medicines, but in general, majority of the time, the IVF works with very simpler ones, simpler medicines. Sometimes we are giving you the injections. So I would say if you have such a doubt, then better is to seek another opinion, a second opinion, because then you are going to have a different angle or a different perspective of what your fertility journey is going to be like. So do not hesitate to take a second opinion if you have this fear of, okay, the treatment offered is really not right, or if you feel that, oh, do I have to take so many medicines, then do have a second opinion on this regard to clear all your doubts and have your journey which is less stressful, with less anxiety. I am Dr. Indu Madhusudhan, infertility specialist obstetrician and a gynecologist at Samruddh Fertility and Urology Center with an experience of more than 22 years. Our motto is nurturing dreams and creating families is just not a slogan but a mission. Book an appointment today with us and together we will help you achieve your parenthood dream become a beautiful reality.